Thank you. A particularly hearty welcome to the summer trainees, who we think comprise a large part of our audience. I hope your summer is going well. So we're going to be very brief with the intros here. I just have a couple of thank yous. Thanks to our organizers and our sponsors, my co-chair, Dr. Georgia Sadler, Jen AACE at the American Association of Cancer Education, as well as Dr. Maurice Godfrey at the University of Nebraska Medical Center. We have over 215 registrants for this, so clearly this is a topic that piqued a lot of interest, and we're really excited to get underway. And last but not least, thanks to the panelists. Without them, this would not be possible. And I think we have a great and diverse spectrum of experiences and programs. So we encourage the audience to use the chat for questions, but also if you see someone else or you hear someone else in the audience who's in a program that you might want to learn more about, use that chat to reach out to them. In addition, the speakers, the panelists' contact information will be made available as part of the chat, I believe, but also as well as the along with the survey that you'll get afterwards, which we strongly encourage you to fill out, because that's how we improve. So at this point, and we will just go through the panelists, let them do their presentations. They're going to introduce themselves, and then hopefully we'll be done around 11:40, 11:45, and we'll have the remainder of the time for questions. And so we'll just conclude now with Jen AACE will talk a little bit about the rules of engagement.
Yep, I don't think you guys need to hear me read these things to you, but I think it's pretty standard operating procedure. Just know that we're being recorded. Rename yourself if you've got some kind of generic device name or something, so that we know who you are. Stay muted, and let us know if you have questions by raising your hand or putting them in the chat. And if you have technical issues, chat directly to me and I will do my best to help you.
Okay. So we will start with the group from the University of Maryland, Greenbaum Cancer Center, Drs. Berry and Intieri.
Hello, everyone. Can you see my slides? Let me make it in presenter mode. Can you see the slides?
Yep.
Yes.
Great. Thank you so much. Well, I'm very happy to be here today presenting with my colleague, Dr. Shannon Intieri, about cancer disparities training and research at the University of Maryland School of Medicine. So let me go ahead, and we'll try to be very brief, and we want to make sure everyone gets through their talk. So this will just be a quick overview, a little bit about my background and a little bit about opportunities available here at the university. So let me start off here, just a little bit of my trajectory and background. So I started off with a bachelor's degree in biology and community health from Tufts, and that's where I took my first epidemiology class. So I'm a cancer epidemiologist by background, and that's where I had my first introduction to epidemiology. And for those of you who aren't familiar with epidemiology, it's the study of the distribution and determinants of disease. So I knew I wanted to pursue more education in that area. So I went on to get an MPH at Yale, and then did more applied epidemiology training at the Washington State Department of Health, which was through a CDC sponsored fellowship. And then I went on from there to return back to Yale and did a joint training program with Yale and the National Cancer Institute for my doctoral training in cancer epidemiology. And I continued on at the NCI for my postdoctoral work. And then I'm currently an assistant professor in the Department of Epidemiology and Public Health at the University of Maryland School of Medicine. So my interests as a cancer epidemiologist cover a few different areas. I'm interested in occupational environmental risk factors for cancer, the interplay between genetics and the environment in the development of cancer, and also biomarkers of cancer risk and prognosis, particularly for prostate cancer. So most of my work currently focuses in that third area. And I've a couple of different projects that are in the space of cancer disparities in prostate cancer. So many of you may be familiar that there's very striking disparities in prostate cancer by race or ancestry. So we see that African-American men are more than 1.5 times as likely to develop prostate cancer compared to European-American men, and they're more than 2 times as likely to die from prostate cancer compared to European-American men. And so I've gotten into some research looking at are there biomarkers that we can measure in prostate tumor that can help us better understand which men are going to progress and which men are not, and help understand which biomarkers may be contributing to prostate cancer disparities. So I've got a K award from the NCI looking at DNA methylation and RNA expression markers, and there's a hypothesis that some of these markers that have been found to differ in tumor by race may also be associated with the tumor aggressiveness. So we're pursuing that hypothesis. And then we have another project. I was fortunate to get an internal pilot from the American Cancer Society Institutional Research Grant, which is layering in additional information on neighborhood social factors and how that contributes to tumor biomarkers and tumor aggressiveness. So those are 2 areas I'm currently working in prostate cancer, and the goal is to enhance understanding of biomarkers that are associated with cancer disparities and exposures that contribute to these markers. And so that's a little bit about me. And I wanted to leave a couple more minutes too to talk about some of the opportunities at University of Maryland. So this is the grant funded training grant portfolio at the University of Maryland Greenebaum Comprehensive Cancer Center. This slide was kindly provided by Dr. Tony Antalis, who's one of the people involved in training opportunities here at the university. As you can see, there's a very long list of different programs for training here in cancer. And I don't have time to talk about all of these right now, but we can always go back to this later. But what I wanted to highlight, one of the newer programs that was just funded is this iReach grant, which is an infrastructure for research in equity, aging, cancer, and health. So it's from National Institute on Aging. It's a combination, it's an R21 phase, which is a 2-year phase, and then there's a R33, which is an additional few-year phase. And this is a collaboration between Georgetown, Wayne State, University of Maryland, and UCLA. And these slides were provided by Dr. Joanne Dorgan, who's one of the investigators involved in this effort. And just this program is going to involve enrolling scholars who will be trained in in this research area. So there's going to be 4 different cohorts who will be comprised of underrepresented minorities, and they will be all spanning all levels from pre-docs to early stage investigators to established investigators. They will be paired with a mentor, and there will be some training involved. And so there's a lot more to come. And this grant was just funded in the past year, so they're just getting started. And then I just also wanted to quickly mention there's a graduate partnership program with the National Cancer Institute. So I actually have two current students I'm working with are part of this program. So they're doing their coursework at University of Maryland for their PhD, but they're doing their dissertation work at the NCI. And this is another great training opportunity. So with that, I will stop sharing my screen and turn it over to my colleague, Dr. Natiri.
All righty. Do you have my slides, or should I share my screen?
Actually, I can share yours. Give me a second.
Okay, thank you. And while Dr. Berry is bringing up the slides, I can start to introduce myself quickly. My name is Shauna Intiri. And just so you kind of know where I am coming from in the world, I did my undergraduate at the University of Michigan, should there be any Wolverines out there. Went to Boston University to do an MPH in social and behavioral sciences, and then went back to Michigan State for med school. So just to give you that information. Can see the slides.
We'll see the slides. Let me just go to the presenter mode. Okay.
Perfect. And you can actually, so Shauna and Thierry, I'm an associate professor in the Department of Family and Community Medicine at the University of Maryland School of Medicine, and gonna go through a couple of slides that hopefully give tidbits for people that may want to reach out, or a little bit of teasers in terms of additional information or things you may want to discuss in the question and answer session. Next slide, please, Catherine. So how I spend my time, this is a question I'm often asked. So I'm a family physician, first and foremost. I always like to tell folks. I also serve as the medical director for something called the Baltimore City Cancer Program, which is a community-based initiative of our cancer center that focuses on providing cancer control services to individuals in Baltimore City and around. Most of the individuals in the program are either uninsured or underinsured, and we focus on breast, cervical, and colorectal cancers. I also serve as a senior medical advisor for our cancer center's Office of Community Outreach and Engagement. And so that is an office that is really tasked with working with the 10-county area you can see outlined in Black, in the state of Maryland, to really improve cancer outcomes for everyone. So there's a disparities focus there. And our charge for improvement is making sure that members of the community in Maryland are able to engage with both physicians, clinicians within our cancer center, and most importantly, researchers, in order to inform both clinical and research priorities within our cancer center. And then I also work as a physician scientist. These pictures are Dr. Swanson, Yanin, and Dari, who were all trainees, physician trainees who have conducted research with me. Dr. Swanson is now in private practice out in Colorado. Dr. Yanin is a third-year resident in Philly, and Dr. Dari is a Heme-Onc fellow in her second year. Next slide. So want to give you a little bit of a river of life into my entry into cancer research. If we have time, we can talk more about that. As a concept that was introduced to me by a colleague of Dr. Berry's and mine, Dr. Londetta Jones. Really, I got introduced to cancer research through service in cancer, the Baltimore City Cancer Program. And the program is extremely effective in terms of engaging individuals who are commonly touted to have poor outcomes in cancer in terms of mortality and morbidity, but the program has been extremely successful. So wanted to understand why that was and kind of how that could be translated into other populations of patients outside of the Baltimore City Cancer Program, and sparked for me an idea to create a text message-based intervention rather than an intervention that used community outreach workers and navigators. Would be ideal, but those folks require more money. So basically started with an idea, have gone through several steps to get the research going, and ideally will end with an intervention. Next slide. A couple of the current projects I am working on. One is looking at increasing HPV vaccination for African-American parents. A second is looking at ambiguity in medical decision-making, specifically around breast cancer. A pilot project to increase diversity in clinical trials, and then transdisciplinary research for community and social impact, a really neat project that partnered community stakeholders with researchers from a variety of backgrounds. And that's, I put River of Life there just to say, we started that project by everyone just talking about how they got to be in the room, which was really interesting and leveled the ground. Whether a person was a community stakeholder, a person who was a PhD or an MD, we really got to know each other as individuals, which set the ground for future work. Next slide. Some UMB training opportunities. Dr. Berry went through several of these. These are a couple more that we can talk about should there be questions. And I think we're close to our time, so we can just do next slide. That has contact information, and I think this contact information will be shared again in the future. Look forward to speaking to you guys.
All right, great. Thank you both so much. And I think we are just going to move right along to Dr. Eileen Dolan at the University of Chicago. Dr. Dolan, you are on mute.
Okay, so can you hear me?
Yes,
Okay.
we can.
My name is Eileen Dolan. I'm at the University of Chicago Comprehensive Cancer Center, and I'm the Deputy Director of the Cancer Center. However, I was the Associate Director for Education and Training for 12 years, and I developed 5 different programs for in the area of either cancer health equity or pathway programs for students to get exposure to cancer research. So I'm going to talk right now about the Cancer Health Equity Training Program. The training objectives are to gain knowledge in critical issues and the current state of research in cancer disparities. We engage in monthly discussions with patient advocates and leadership about critical issues in cancer disparities. And we participate in clinical, community, and policy engagement activities. And we gain knowledge of and exposure to career opportunities in breast cancer and other types of cancer disparities research. So within the University of Chicago, there are many PhD programs, and students would apply and get into a PhD program. And then after their second or third year in the PhD program, they can apply to the Cancer Health Equity Training Program, which is a supplemental training to their PhD. And this Cancer Health Equity Training Program will provide them with multi-tiered mentorship. Experienced program and leadership team is running the program. We have disparities. We expect the individuals to be doing disparities research, but oftentimes they're not. And through this program, they integrate in cancer health disparities within their research. We have didactic coursework, clinical engagement, community engagement, policy engagement, which I'll talk about in a minute, as well as ethics training, leadership skills, career development, and they attend a conference. The goal is to create a research workforce that will eliminate cancer disparities. And this Cancer Health Equity Training Program is dedicated to graduate students and postdoctoral fellows. And it's in, it is part of many other programs that are within the Cancer Center that are cancer relevant, that are dedicated to individuals underrepresented in the sciences. So this is just one of many programs that we run, and the one that I'm going to focus on today. The leadership includes myself and Dr. Olapati. We also have a number of administrators who help run the program. Megan McKinda is the director of our education, training, and evaluation, as well as Basha Galinsky, who's a scientific coordinator, and Michelle Demecki, who's a program coordinator. All of these individuals run all of our programs, and this is just one of the programs that they're responsible for. And then we have 2 patient advocates that attend all of our monthly meetings, that are very involved in the review of applicants with us, and the decision of who is admitted to the program, as well as providing with the students with ways to provide research seminars that are more for the lay public. They help them with abstracts as well. The program was initiated in 2016. We received funding from Komen from 2016 to 19. We then submitted a grant, but because of the pandemic, they held off for 2 years, and we received our trend funding, which is this is for graduate students in our program for their stipend, as well as additional money for tuition and travel. As I said, it's for graduate students and postdoctoral fellows. We take up to 7 trainees per year, and we've now trained 23 trainees over the last 5 years. And many of them, because they so much enjoy their first year of this fellowship, that they ask to do a second year, so they can apply for a second year. And we oftentimes admit them for a second year. We have monthly meetings that include the patient advocates, all of the students, and then different topics related to cancer health disparities. And all of the students present at the University of Chicago annual Health Equity and Cancer Disparities Symposium that is hosted in the fall by the Cancer Center. We also take all of the students to the AACR Health Disparities meeting that's held in September every year. The clinical engagement is, they're expected to do 10 hours over the course of a year, and this is led by Dr. Rita Nanda. They shadow physicians in the surgical or medical breast cancer units. They attend breast cancer tumor board, and they engage in discussions with patient advocates regarding patient treatment perspective from different patients. The policy engagement is 10 hours per year as well, and it's led by Dr. Blaise Polite and Ms. Michelle Demecki. And this is where they can attend the American Cancer Society, Cancer Action Network, advocacy events. We often take them down to Springfield to fight for state funding for different initiatives related to cancer health disparities. Or they're welcome to go to Washington, D.C. With American Cancer Society, Cancer Action Network. They attend lectures focusing on public policy that creates barriers, and they engage, as I said, with local, state, and federal representatives. The community engagement, which is led by Dr. Neetha Lee and Ms. Gina Curry, who are part of our community outreach and engagement within our cancer center, for their community engagement, again, this is 10 hours over a period of a year, and they attend and coordinate local cancer focus events with Susan G. Komen or the American Cancer Society. They might attend or put together a team for their one of their relays or their runs or their walks. They volunteer with local food equity organizations, Feed First, other organizations, or they can volunteer to support other cancer-focused Cancer Center pathway programs. So oftentimes they're mentors for our younger students, our high school and undergraduates. And then I just wanted to mention that all of the students are required to take a course that I direct, which is called Health Disparities in Breast Cancer. And this course is available to postdocs and graduate students. It is also open to undergraduates, and we have about close to 50 undergraduates that take it every year. It's a 9-week course. We're on a quarter system at the University of Chicago. It's a departure from many traditional biology courses. It's very popular among the undergraduates because it brings in the clinical, biological, genetic, socioeconomic, policy issues that surround cancer health disparities. And we have experts come in from all of these different areas to speak, and you can see some of the topics that we cover are listed here. We also have other training activities. We do a book club every year. We've discussed The Death Gap or How Inequality Kills by Dr. David Ansel, and then we have him come every year to discuss with the students the book and have them have the opportunity to ask questions about different aspects of the book. We have leadership training through My Choice program and the BSD Postdoc Association that students can attend. And then, as I said, they attend 2 conferences, and that's our internal conference and also the AACR Health Disparities Conference. And this is just a few testimonials from trainees. One of them said, in my first year, the interaction with patients, healthcare workers, and multidisciplinary teams provided invaluable insights for my research as a career cancer epidemiologist. I stepped into my second year. My increased involvement in community outreach activities gave me a deeper understanding of the lived realities behind the statistics I analyze and the health disparities we seek to combat. In all, the program was an eye-opening journey and was made even more memorable by the amazing mentors and fellow trainees. So, and you can read the other testimonials, but I would say that for our first year, as I said, they do 10 hours of clinical, community, and policy engagement, but in their second year, they can take one of those 3 and really do a deep dive and spend 30 hours over that year within one particular area they're most interested in. So I'll end there. Thank you very much, and be happy to take questions at the end.
Thank you so much, Dr. Dolan. We are going to move along to Regina Idoate. I should have checked with you to make sure I was saying that correctly before, before we got to this point, but from the University of Nebraska Medical Center. And you can unmute yourself and share your slides whenever you're ready.
Thank you. Let's see here. All right. Well, good morning, everyone. Osio, Regina Ilawate Dawado, Chichalagi. I'm grateful to be here. My name is Regina Ilawate. You were super close in your pronunciation. I'm a citizen of Cherokee Nation and an associate professor at the University of Nebraska Medical Center, where I also serve as the director of spirituality, culture, and health. Super grateful to be here. And what's going on? Am I freezing?
Yeah, we keep getting pauses in your voice, and then I don't see your video moving.
Well, I think it's working now. I'm sorry.
Slides have moved along.
Going on. I'm sorry. I've been following along clearly without any problems. Huh.
Okay, maybe it's all good now. Your video is unfrozen for me now, so
Okay,
maybe it's caught
we'll
up.
try, and if it does this again, if we could move on to the next person, and I'll try to troubleshoot.
Okay.
I apologize. Okay, I'll try to move quickly. I'm not sure what you all caught, but I'm a citizen of Cherokee Nation and an associate professor at University of Nebraska Medical Center, which is based in Omaha, Nebraska, where I get to work with Native students, particularly mostly, who are interested in the health professions in a program called Youth Enjoy Science, which is funded by the National Cancer Institute through an R25 grant. And just a little background about me. I know we don't have a ton of time, but I'm also a graduate of the University of Nebraska Medical Center and of the College of Public Health. And I think I'm freezing again. Darn it. No.
Yeah, you are. Unfortunately.
Try muting your screen and see if that helps.
Yeah, like turning off your video.
Your video, yeah. I'm sorry, yes, turn your video.
Okay, I don't even hear her right now.
Why don't we try to go on to the next one then?
Okay.
And circle back.
Yeah, I'm gonna, oh, she stopped sharing her screen. So we'll go ahead and welcome our Moffitt guests. All right, anytime you're ready.
All right, well, welcome everyone. I will go ahead and get us started. My name is Carol Boxa, and I'm here with Secura Peoples, who will be co-moderating with me in this presentation, discussing the cancer disparities training and career path here at Moffitt Cancer Center. We are not a university, however, we do affiliate a lot with the University of South Florida and other institutions nearby.
So good morning, everyone. As Carol mentioned, my name is Zakira Peoples. I serve as the program manager for the Southeast Partnership for Improving Research and Training in Cancer Health Disparities, or SPIRIT. And I also serve as the regional coordinating director for the Geographic Management of Cancer Health Disparities Programs, Region 2. Both of these initiatives are funded under the National Cancer Institute's Center to Reduce Cancer Health Disparities, and they fall under the umbrella of Partnerships to Advance Cancer Health Equity, or PACHE. As you know, we love a good acronym. So with the main goal of increasing diversity in the biomedical research workforce by creating unique training and professional development opportunities for individuals from underrepresented backgrounds. And I think it's important to note that we use NIH's definition of underrepresented in biomedical science research, which is not just limited to racial and ethnic minorities, but could also include sexual and gender minorities, first-generation Americans, economically disadvantaged individuals, and so on. I'll pass it off to Carol.
All right. Okay, so once again, my name is Carol Boxa, so I will talk a little bit about my background. I completed my undergrad at USF and am currently now an MPH student at the University of South Florida, while also a research coordinator here at Moffitt Cancer Center for now 5 years. And I have worked on a variety of projects. I know there's a lot of students here, so my trajectory was like being a volunteer, and then I was able to get an internship here at Moffitt, which then led to my job and career that I currently have here. So I have worked in a variety of projects focused on smoking cessation here in the U.S. Spanish preferring language, preferring Latinos and Latinas, a prostate cancer genetic risk study, but most of my time has been focused on colorectal cancer screening uptake among patients in federally qualified health clinics, as well as my main focus at the time is a diversity supplement that I have here at Moffitt, but is funded by the NIH, and that's titled My Portal Cares that I have here on the slide. So these positions have intersected in a variety of ways to the cancer health disparities field, working with underserved communities who may have the intentions of getting current screenings, but may not know the necessary of where to get them or how to get them. That's where myself as well as my team come in, and we provide these interventions that have a lot of culturally tailored education that come in different formats such as printed materials and video photonovelas in their preferred language, so we can share with the community and partners. Additionally, I am in a unique position where I do have this diversity supplement, the My Portal Cares, which is aligned to assist, which is again funded by the NIH to promote diversity in health-related research careers, such as cancer health disparities. And it is something that I complete while I'm also completing my MPH to get that dual training as well as experience, which is conducting a project. And this is going to be focused on that web-based portal usage in federally qualified health centers among multilingual groups. So I will deep dive into this a little bit more, but overall, the NIH asks you to have a parent grant that has about 2 years or about that remaining during the application, and that you have that career development as well as a mentor plan so that all the components can be completed throughout the 2 years that they usually get the funding for. All right. I will go on to the next slide now. So we're going to be discussing some of the cancer career trainings and support that we have here at Moffitt Cancer Center. There is a variety of different opportunities depending on where you are currently on your educational trajectory. So we have high school, undergraduate, graduate, and we will now home into some of the ones that we specifically work with and help train interns in. So the first one is the U54 partnership that we have with Ponce Health Sciences Universities, and then I'm Moffitt Cancer Center. And students are able to come in and have 8 weeks where they get paired with a principal investigator working in their preferred, in their interest or field. And then they get one-on-one training with those principal investigators, as well as project managers and coordinators to get firsthand experience of current interventions, the development of them, as well as recruitment and outreach in the community. Here on the bottom left-hand corner, you have some of our interns in one of our community programs that we did, where we go to the community, give them prostate cancer education, a presentation, and then also inform them about a current intervention that we have ongoing. And then on the right, we have other opportunities where they get training for their field of interest, as well as career development.
Adding on to that, another program that we have currently at Moffitt is SPARK, or Summer Undergraduate Program to Advance Research Knowledge. The eligibility requirements in short is that you must be 18 years or older. So we are really targeting undergraduate students, and you must be a US citizen and currently enrolled in an undergraduate program. It is important to note for this program that there is no minimum GPA requirement. However, it is a very competitive program, and we accept students from all over the country. So typically we say that students need to have a B average, but most students have much higher than that. And then in addition, Students also need to submit a very strong recommendation letter, and we'll get into mentorship and the importance of recommendation letters a little bit later in our presentation. But through the Spark program, students get to participate in an immersive summer internship program at Moffitt Cancer Center on site in a number of different research labs. So they are paired with a faculty mentor and they work in their lab for the summer. And you can see the extensive list of different programs or different labs that the students get to work in under the Spark program, including but not limited to dry lab experiences through community-based participatory research in the Department of Health Outcomes and Behavior at Moffitt, as well as integrated mathematical oncology, molecular oncology in the basic science realm, and so on and so forth. One of our newest programs at Moffitt is the Encourage Diversity program. It is funded in part through the American Cancer Society. And this program has a keen focus on training individuals from underrepresented backgrounds in a wide range of fields related to cancer research, with somewhat of a focus on cancer health disparities in particular. So we have just initiated our inaugural cohort for this, and this program is year-round, so the students come for an immersive summer experience, and then they stay engaged throughout the year. As Carol mentioned earlier, one of the things that's really unique about Moffitt Cancer Center and Research Institute is that in Tampa, we are somewhat embedded in the campus of University of South Florida, so there's a lot of collaboration with USF and the University of South Florida. But for the Encourage program, these students participate in courses related to health disparities, hallmarks of cancer, responsible conduct of research, and so forth. They also get to do research experience in terms of presenting at Research Day and the annual Moffitt Scientific Symposium. So if you are an undergraduate student interested and you're in the Florida area, in the Tampa Bay area, and would like to participate in this, applications for cohort 2 will open in the new year around March of 2024.
All right. So one more second.
Yes, very briefly, on the PhD realm, we have a program in collaboration with the University of South Florida. It really hones on 4 different areas. You can get a PhD in cancer biology, cancer chemical biology, immunology and immunotherapy, and integrated mathematical oncology. The programs, the requirements and eligibility differ, as well as the coursework differs for each of these programs within. So I encourage you to check out the website, moffitt.org/education, to really see which program would be a great fit for you.
And just some recommendations that we have for individuals, and particularly students, to make your application more competitive is to volunteer and participate in internship opportunities. Sometimes those internship opportunities need more applicants, and just putting yourself out there can definitely be a step forward to get you your foot in the door. That way you can also then build relationship and build your network with individuals to help you then apply for that graduate program, or apply for that position that you are looking or interested in forms of letters of recommendation, crafting your resume, as well as having those individuals in your network review them to make sure that you are targeting those points that you need to develop yourself in to hit that career milestone. And just as I had stated before, one of my first way to get into this career was actually volunteering with one of our community partners, and that's how I was able to loop myself into Moffitt. So those opportunities those experiences definitely open the door for you. All right. We also work a lot with different programs such as the NIH. And as you see here, one of the diversity supplement that I had spoken a little bit more about in the beginning, that is actually something that if you are a student in high school, postdoc, or actually an investigator, you can look into your institution if they are able to collaborate with you. And if there's any principal investigators that are willing to give you that opportunity to apply for one of those grants. And then here we have some information about other training programs that we have. The T32 program that helps fellows develop themselves into independent investigator, as well as other NIH opportunities with partnership that can partner with Moffitt in post-bac fellowships. But thank you everyone for taking the time to listen to both of us.
Thank you for your time.
Thank you both. And Dr. Idoate is back and ready to give it another shot. So we're going to go right to her.
And we're going to try this again. I'm so sorry. Okay. Okay. Is it working? Is it working now? Can you hear me?
We can hear you and I see your screen.
Thank you. If it freezes this time, I'll try turning off video and we'll see if I can just keep going. But anyway, thank you for your patience and thank you for your attention. And it's wonderful to actually be following all these leaders in our workforce development, and so grateful for all of the work that you're all doing, to all the presenters and all of the students that are on these career paths and leading us really. So I'm not sure what all I shared, but I took a pretty winding path to get to the place where I am. So I studied psychology as an undergrad and then ended up studying Spanish and Spanish language and culture, and then studied Christian spirituality, and eventually found my way to preventive medicine, which is what I earned my PhD in. And while I was doing that, I also studied Native American studies academically, along with maternal and child health. So all of those things combined kind of fit into how, like, my lens of cancer research and what I get to do specifically as a cancer researcher. But more importantly, I get to work as a principal investigator to the Youth Enjoy Science program and work and mentor students in public health, community-based or community-engaged cancer research. And so you just see in this image here those who have really impacted that path. You know, just the fact that I'm a mom has influenced the fact that I do a lot more work in maternal and child health. The fact that I'm not just a mom, but also a daughter and a granddaughter, and a granddaughter to a grandmother who was a cancer survivor of breast cancer, then eventually had liver cancer and died from liver cancer. So that's part of my story and why this is really important work to me. And then all the awesome students that I get to work with and colleagues that just make this program what it is. So I've worked at a lot of schools and studied at a lot of schools. I love school. And I'm sure all of you do too, which is why you're here right now. But I think that's really important. And it's so important to have mentors and family and or people that are like family, right? Our kinship networks really that are supporting us along the way to get to where we are. And I'm going to make this full screen. So I shared a bit about what I do. So my work is really focused on maternal and child health and environmental health, and then cancer prevention more than anything, I would say. And that manifests itself or works into or becomes a part of workforce development, medical humanities and the arts, and then community and community engaged work, which is a lot of fun. And I get to do that as a principal investigator in the Youth Enjoy Science program, which is located or really a place-based program in different places. So we're housed in the College of Public Health. And so there's students that do cancer research that's more community engaged, community-based participatory research that's focused on public health and more cancer prevention and education efforts. And then there's also lab-based cancer research that's housed in the Buffett Cancer Center, which is on our same campus in Omaha, but doing very different work under the leadership of Dr. Joy Solheim, and then we also are based in Arizona in the College of Medicine and have a partnership with the University of Arizona, and that is led by Dr. Karen Hastings. And our entire program is focused specifically on Native populations. So with the aim of raising future generations of cancer-specific health professionals and researchers. And so this is just a slide to recognize those who have worked really hard on this project. We're in our 5th year right now of this work. And I also want to give a shout out to Aislinn Rookwood, who's our program manager and makes all of this happen along with us. So all our work really is very community-based and culture-based, and that's something that I can't emphasize enough. And we have students from many different tribal nations and urban and rural all combined. So we do a lot of work within the Omaha area's Native Indigenous Centered Education program with middle school and high school clubs. So we have an iResearch club, which is called Indigenous, or stands for Indigenous Research, where the students have specific projects that they work on each year, which are related to environmental toxins and cancer. So we look each year, we focus specifically on one topic, whether that's soil, air, or water, and the students do research within their place, you know, within the waterways where we live, or within their own homes, testing radon in the air, or testing the soil within our environment where we are for carcinogens. And so those have been really cool projects. And we also have a Cancer Biology and U Day where we bring students together from all over the region, and it's hundreds of Native students that come together and do specific cancer related research activities that are really hands-on to just get people engaged to begin with and see, oh, that this is really interesting work and can be a lot of fun and collaborative and engaging and meaningful. You know, if we do our best to make it as meaningful as it can be and specific to the students that we're working with in those ways. And you see some of those examples here. We also have some e-modules and e-learning resources that are available to everyone through our website, and I can share with those in the chat later. So we have programs in middle school and high school, and then that leads to the opportunities, which is happening right now at UNMC, for a week-long summer health professions education program that introduces students. They get to stay on campus and get introduced to the health professions and different cancer-related careers, either research or actual healthcare provider. And it's very diverse, and so it's hard to even name it all. But we work with the College of Medicine and Public Health and Allied Health, dentistry, nursing. So it's amazing how many opportunities are out there to be a part of cancer research and education and then treatment. That's a huge part of this as well. So these are pictures here of our program when it was virtual during COVID, and also then here in person. So the students stay in the dorms and get introduced to all these different fields and projects and professors, and just kind of get a sense of what they may be interested in and what could be in store for them on their path. And then we also then students move or graduate from the middle school iResearch clubs or high school iResearch or the high school camp, and have opportunities to engage in more intensive research internships. And that's what you see images of here as our cancer research interns. And those can be at the high school level or undergraduate, and they either work in the lab or work in community engaged cancer research. So you see that diversity here. We have one student who's been doing portraiture and interviews with an Osage elder who's a survivor of every type of skin cancer there is, and published on that in the American Medical Association Journal of Ethics. And then we have students who have been doing really intensive work in the labs, either in the Buffett Cancer Center or in the College of Medicine at the University of Arizona. And then they get opportunities to present their work, share their work, either through publications, but also through academic presentations, community-based presentations. So we have a lot of fun. And these are just some of our students that we get to work with who are representing our program so well.
Dr. Ito Ate, I'm so sorry to interrupt, but we have to move on to questions so that we
Okay.
have time.
Not to worry. Okay, I will stop sharing. Thank you all for your time, and I would be happy to talk more with anyone about this at any point.
Great. Thanks to all the panelists. Those were wonderful presentations and really an impressive array of programs available to our trainees. So at this point, we'll certainly take any questions from the audience. You can raise your hand or put things in the chat box. I collected a couple of questions from trainees in our programs here. So as hopefully some are coming in the chat box, one that was given to me was, what are some of the personal characteristics and professional qualities that are required to be successful for a career in cancer health disparities? Yeah, and this is to all the panelists essentially.
I would say, you know, a willingness to learn and to be open to many different facets of cancer health disparities. So, for example, when I started the Cancer Health Equity Training Program, one of my colleagues said to me, you know, this is cancer health equity and disparities has nothing to do with genetics or biological components. It's all, you know, related to structural racism and socioeconomic issues. And I feel that there are many facets that we need to learn about and be open to. So I would say, you know, professionally, just be open to, you know, that this issue of cancer health disparities, many different components to it.
I'll also add in quickly, some fortitude is important. I mean, it's a long journey from undergrad to graduate school, and it's really important that you, you know, build a network of support that allows you to kind of see it through. You will have some failures, and we like to call them lessons learned, but to learn from those and to pick up and keep moving. In the grant writing world, a no is inevitable. So you have to know how to deal with the failures of what comes with that. You won't get every internship that you apply for, but it's important to keep it moving, learn from what you did, and then apply for the next one. So fortitude.
Yeah, I think agree with everything that's been said today, and we'll just, or today through the panelists, and we'll just add to, I think a passion for community and community engagement is key to success, and a recognition that truly your partner in addressing inequities and cancer outcomes is those who are within the communities that are confronted with these inequities. And really that recognition, I think, is key to success and to our ability to knock out these disparities.
Yes, I totally agree. And I even add that, yes, so important, all of what everyone shared. And I also think it's important to recognize within ourselves, like our own positionality within the work that we're doing, and make it meaningful and purposeful for yourself. So you have that to hold on to and to carry you through those times when you know, when maybe it is extra challenging, or the support or the mentors or the whatever it is we need that's normally carrying us through isn't there. We have our ancestors, we have our own lived experience, we have our reasons for doing what we're doing beyond everything else, you know, around us at the time. So yeah, absolutely.
Great. Thank you. We do have a question in the chat box now. This is from Ronaldo Trejos. Since inequities and disparities in cancer are often reduced to highlighting how future research will address or identify mechanisms, what can we do in our work to ensure that standards for even reporting stratified data, expanding community recruitment efforts for underrepresented populations, and others become common and best practices? Great question. Can y'all see that? Anyone's welcome to tackle that.
No, I guess I'll start, and I don't have a good answer. That's why I was waiting for someone else to but in my field of genome-wide association studies, there's a paucity of data and for African Americans and Hispanics and so forth. And so it really, unless we begin to increase different populations in these kinds of studies, we're just going to continue to widen the disparity gap, because as we develop new drugs based on the data that we have in our hands right now, it will be based on a genetically European population. So I would love to hear others on how to expand it. We have a cohort of testicular cancer patients in which we're evaluating those who are genetically African versus those genetically European to see whether or not there's greater degree and severity of toxicities due to chemotherapy, and we're finding differences. So these are really important studies, and we just need to keep pushing towards involving and incorporating other populations.
Yeah,
I can add a little.
Go ahead.
I can add a little bit more on this one. I definitely believe that involving these communities in our research is important, as well as having individuals who look like the community in our teams, providing them the opportunity to get the training in this field. That way it creates the trust that we need to have them represented in our research.
Absolutely. That's exactly what I was thinking, Carol. And Dr. Is it Natiri?
Interi, yep.
Yeah, Interi. So I think what you shared earlier about how important it is to really be doing the work that the communities we're working with are interested in and engaged in. I think it comes down to that in our relationships and building trust and being ethical and working with community instead of, for or on or in, right? So in that way, when we're engaged with community and the populations who we would like to be more involved in this research, we're building those pathways to increase involvement, right? By doing it in the ways that work for them and by doing the research that's of interest to them. And part of that is, designing our projects in partnership with the populations who we want to work with. Part of it is our recruitment methods, but it's also like long-standing trusted relationships that we need to establish. And so part of that is our dissemination, right, of our results and how we go about that and how we share it, that it's not all in academic publications, right? That we are like doing this in ways that are understandable and relatable and important and meaningful to the communities that we're working with, so that there is that sense of purpose and meaning in the research to the peoples who want to be involved in it, right? Take part in it.
Yeah, and I think just to continue along with that train of thought is that if you're working with community organizations and stakeholders, they're not academicians. And so they don't necessarily need to get that grant approval or that evidence-based mechanism to actually translate it into the real world. And so I think that's neat too, that if individuals have the information and knowledge, they're much faster kind of getting it out there. They are better at dissemination and implementation than sometimes we are, because they're not restricted by the barriers and formalities that we have.
Yeah, I'm really excited with one of the projects I mentioned today. We actually have 2 community collaborators, which is really, it's a new area for me, but something that I'm really excited about to have more community input. So from the beginning, so we were talking about like, what are the exposures we're looking at? What are we measuring? And also sharing results as we go along. And then again, as you all have mentioned, the dissemination part. So I think that they will be really critical in thinking about how to package the information and how and where to share it. So I'm really excited about that aspect.
So we have a question from Dr. Waterbohr about just in the context of this meeting or other meetings, have you all seen things in your peer programs that you would like to implement? How can we put together best practices? And I think this is a really important point, because whether we're working with Indigenous populations or inner city youth, They're distinct in some ways, but there's certain commonalities. So I think that we can learn a lot from one another. So any thoughts on that?
I can say briefly that I know that our programs at Moffitt have built on previous programs and from lessons learned. I know that a lot of our outcomes we've published in a Journal of Cancer Education, and we've also been able to reference other programs that are existing or under the same umbrella of the Partnerships to Advance Cancer Health Equity. So in short, I mean, on here, I don't think we had enough time to really delve into the inner workings of all of our programs to see what we could use and collaborate on, but I'm sure there is definitely some overlap, and we're always open to those ideas.
Yes, and ways to share those ideas are so important too. I think we need those like those coalitions and pathways and networks structure for us to be able to communicate and share and support each other with resources, ideas, examples. That's one thing we're doing with, there's a group called IHEART, Indigenous Health Education and Resources Task Force, and we work together. We're trying to build that system, so we have regional groups and then we have a national group that comes together, and we're really trying to have greater reach and more support for each other and for the students and healthcare professionals and researchers that we're aiming to serve.
Let's see. So I'm seeing, a lot of interest, and one of the suggestions was that perhaps we could even do a follow-up on this topic and maybe delve a little deeper. I will, okay, here's Georgia. Did you want to unmute and go ahead?
Sure. Thank you, everyone, for being here. Thank you for our panelists. Most importantly, though, thank you for our audience participants. The whole point was to introduce you to the wide diversity of careers and cancer disparities and health disparities too. We don't just address cancer disparities. What we do addresses all disparities in health and social justice issues because they're all tied together. So I wanted just to close with a reminder that we're going to be sending out a survey, and that's very important for you all to fill out because we're thinking this might be an annual program that we would do. And if we've had a wonderful turnout and wonderful panelists. So your responses to that survey will be very important in helping us to plan a future survey for the next generation of students next summer. And I just put a note in the chat room, all of us research study, the All of Us research study is a great way to start community participation efforts because most people don't know about it. I had my 96-year-old mother involved, I'm involved, but talking to my husband and trying to get him involved is a nightmare. So we have to think about different approaches for different folks. It was easy for me and my mother, but not to my husband. He seems like, oh, that's too much work. So it's a great study. You're actually getting genetic results. I think it's on 58 different genes that they're analyzing your blood contribution against. It's a blood draw, it's a saliva draw, I think, and I'm not sure what else, but definitely information about you in an ongoing survey every year or so. So it's a wonderful, simple way to get people involved in research who might not otherwise, because there's definitely something in it for the participant. And that's one of the first questions potential participants ask, why should I do it? What's in it for me? Well, here we have something I just got my DNA results, and I thought that was really a nice way to thank us for being involved. So on that, I'm going to say goodbye to you all. Thank our panelists one more time. And again, the audience, if we don't have you, we don't have an event. So thank you all for taking part. And thank you also to my colleagues, Jennifer and Brett. Thanks, everybody. Bye.
Thank you.
Thank you, Brett and Georgia.
Bye, everyone.
Thank you.
Dress nicely, Georgia.
Always.
See you next time. Yes. Bye-bye.
Bye.
How smart.